Hi, Dr. Charles Nivens here. I'm located in Bluffton, South Carolina, which is about 30 to 40 minutes out of Savannah, Georgia, and about 20 minutes out of Hilton Head Island, or the mainland prior to getting onto Hilton Head Island. I've been here for about 20 plus years, treating patients mainly with chronic and acute spine as well as musculoskeletal disorders, pain mainly. And we have for years been treating traditional patients with steroid injections, various medications, and various types of techniques to minimize people's pain, to get them more functional in their life. My training was in physical medicine and rehabilitation. So I happened upon this type of work when I was in medical school, and which I went to medical school in Medical College of Georgia, did my training at MUSC in Charleston, South Carolina, in which I did an internship and a residency in physical medicine and rehabilitation. It was during my chief residency year, which is the last year of my residency, in which I was exposed to spine medicine, which is basically a conservative approach to spine problems, in which we are trying to keep people away from spine surgery if possible. And during that process, I really was very interested in those types of treatments because having pain myself and having many people that I knew in my family that had spinal disorders, it was something that interested me quickly. So I did a fellowship, which is extra training after your residency, in which I specialized in treating these types of disorders through conservative approaches. And after I finished my training, I came down to the Bluffton area, again outside of Hilton Head in Savannah, Georgia, and opened up a practice. And I've been treating patients, as I said, for over 20 years. And during that time, I had been exposed to stem cells when it first became more widespread and mainstream. I, as a physician, have always been skeptical of new modalities, new treatments, as well as new medications. I've always liked to see how they fare in the market after they've been out for a while to make sure they're a viable treatment and that there are no problems associated with that. I never really got into stem cells specifically because of the problems with tumorigenesis potential, rejection. But recently I've been exposed to regenerative protein arrays, RPA, in which this really was something that I found very interesting and started looking at some time ago. The thing that I liked most about this particular avenue of treatment is this protein array is essentially the cellular content, so no DNA, no cell material is being transferred to the patient. It's strictly the mechanisms within the cell that can promote healing and inflammation. What I do traditionally and have for many years is treat inflammation. That is really the crux of what we're trying to do in most of the areas that we're treating when it comes to pain. If you're having inflammatory responses, you're going to be painful. And all we have in traditional medicine for that, for the most part, are anti-inflammatories, which have their own set of troubles over time, as well as steroids. Steroids and anti-inflammatories, if used correctly, are a viable treatment option, but there are times that they just do not get patients where they'd like to be. The other avenue that steroids do not address is healing joints or healing tissue that have been disrupted either through inflammation or possibly an injury. And that is what has been very, very interesting to me, is that the data that's out there worldwide is that these products are able to really hone in on areas of concern where there is tissue damage and inflammatory responses. And we've been able to, these protein arrays actually are able to address that by targeting these areas specifically. And not only that, they're able to heal the environment potentially and stop the inflammatory response. So once I decided to move forward on entering this into my practice, the one caveat that I really liked about this is that there is the ability of these substances to treat inflammation, but also heal the tissue. And it has been widely successful worldwide. And we are going to bring this into our practice cautiously, as I am. We are going to bring this particular product in because of the fact that there is no DNA transfer, there is no cellular transfer, and it's a very safe product. And again, has been shown to be very sustainable for patients as far as trying to treat their chronic pain and even repair other types of injuries that patients suffer with. The other thing that I like about this particular product is that we don't have to keep it at a deep freeze. We reconstitute this for each patient. It has a long shelf life and very safe, and we just reconstitute it when the patient is coming in for treatment. So typically how this will work is patients will call and they will get an appointment, and I will do a consult free of charge to discuss what their needs are and where their problem areas are. Typically, we'll get x-rays. If I feel like there may be more data that needs to be acquired, there may be an MRI or a CT scan based on what is going on with the patient. But typically, I'm going to at least get a plain x-ray to evaluate the area, and then we will discuss what my treatment options will be. These appointments will typically take 30 minutes to an hour based on what we're going to treat and how we are going to treat the patient. Sometimes we'll do a joint injection along with a systemic injection, meaning something within the IV, or it may just be a joint injection, which would be a shorter visit. But neither here nor there, you can expect to be here for an hour, sometimes a little more, sometimes a little less, but in that general area. The follow-up will be with me. We can either do that in person if the patient so desires, or we could do that through a telemed visit in which we can do a Zoom call, if you will, and discuss what the response has been and how they're doing. This is something that is very exciting for my practice. It gives me one more avenue to treat pain, but also in this particular treatment phase, we're able to actually hopefully heal the damaged areas that people are suffering with. So this is something that I think is going to be a very nice, seamless transition within my practice to do what I've been doing now for over 20 years, is trying to get people's pain under control and get them more functional in their life. That's really what it's all about, is functionality and being able to have less pain so you can go do the things that you enjoy doing. So the type of patients that I treat in my clinic are musculoskeletal type problems, which would be joint problems, weakness, numbness, and of course, spine disorders. In my vast array of treatment modalities, I do everything that as far as spine work, I do everything under fluoroscopy, which is basically a real-time x-ray. And that just ensures 100% accuracy in what we're doing and where we're injecting. I also do EMGs and nerve conduction studies, which is a test that basically is a study of the functioning of our nerves. So let's say somebody has numbness or weakness. This is something that we can identify where that's coming from and how significant that is. We also do various joint injections with steroids and also RPA, and that could be shoulders, elbows, knees, hips, pretty much anywhere we are able to treat. I also do treat spinal stenosis, which is narrowing of the spinal canal. Very difficult diagnoses for the patient. Those folks tend to not want to stand or walk, and so their world becomes much smaller. And there's a new technique that is, I say a new technique in comparison to traditional spine surgery. We're doing percutaneous debulking of the spinal canal, which in layman term basically means we make a very small incision. It's a surgical procedure, but the incision is about less than an inch. And we do this under basically a cannular system, which is basically a tube that we use, and we make minimal tissue dissection to go in and open up their spinal canal by taking out some of the ligament that has overgrown. And this type of treatment is something that I've been very excited about because it gives me one more avenue to treat patients that have these debilitating pains. And in conjunction with that, RPA may be something that we could add in with that, that I think would help with the inflammatory response that we commonly get when we're doing procedures like this because of tissue disruption. We also are very excited that there's new products coming out for knee pain that we use that are joint, what we call viscosupplementation, which we are able to put the normal gel-like substance that we lose as we age. We're able to replace that in patients' knee joints, and other joints are being looked at as well. And so the other type of treatment that we do for chronic pain when there is resistance to just about all modalities is we have brought in peripheral nerve stimulation, which is basically like a TENS unit on the inside where we can target specific nerves that are causing patients pain, and we can block that signal to the brain. And the beauty of the product that I use, we call it the Freedom Peripheral Nerve Stimulation System, because there's no battery that has to be implanted. We're able to run these devices through electromagnetism in a device that patients wear when they feel like they need to use it. All of these will be something that we can supplement with the treatment with regenerative treatments, as we discussed earlier. And something that we try to promote to keep people away, again, from dissection, surgery of any kind. I do that one surgical procedure, but it is minimally invasive. It's called the MILD procedure. That stands for minimally invasive lumbar decompression. So all of these things are trying to keep people away from big surgeries and truly any kind of surgery, because most of the time, over time, those tend to fail, or patients have continued pain, if that's the way you want to look at that. So these are all exciting things that we do here, and bringing this new product on board will only be a great adjunct to the current treatment that we have. So the type of insurance that we take is pretty much all of the major carriers, Medicare, and all the private folks. I'm not aware of any insurance that we really don't take. There may be a few, but those would probably be companies that we just don't see a lot. So we do traditional work comp, we do Medicare, Medicaid, all the private payers. And of course, I have my share of self-pay patients as well. Now, RPA is a self-pay product. Medicare or any of the private companies do not cover it, and we have programs that we can assist patients with payments for that as well. Again, this is Dr. Charles Nivens from the Spine Medicine here in Bluffton, South Carolina, and I look forward to seeing you.